Hi viewers, today we are going to discuss fish diseases and control measures. Under this topic, we will discuss introduction to the fish diseases, types of diseases and viral diseases, bacterial diseases, fungal diseases, protozoan diseases, helminthic diseases, and finally crustacean diseases and their control measures. Now, what is a disease actually? A disease is an abnormal condition that affects the body of an organism. It is often considered as a medical condition associated with specific signs and symptoms. It may be caused by external source, factors of external source, otherwise the internal factors. External factors may be the infectious agents and internal factors may be internal dysfunctions such as autoimmune diseases. Whenever we are talking about the diseases of the fish in the aquatic environment, the water bodies, in natural water bodies, fish are infected with diseases through the obligate parasites because the fish is also one of the hosts. In culture ponds, occurrence of disease is common because the higher stocking density per unit area and the metabolites released by the culture organisms create stress. The pond water may also carry certain disease causing agents because of the environmental stress caused by the changes in the water quality parameters and biomass of the cultural organisms. Disease occurrence during culture is generally encountered. Fishes are very delicate and they do not spare any kind of infection or ailment. Infectious diseases are serious and can wipe out a great many fishes, and the diseases, otherwise the disorders, they may be classified like congenital diseases, traumatic diseases, degenerative diseases, and the infectious diseases. Congenital diseases are deformities with which the fish is born. By born, they are occurred in the individual. Example, the missing of gill covers, that is missing of operculum, missing of fins or twisted backbones. So those diseases, deformities occur during the birth. By birth itself they have that. And traumatic diseases, these are produced by injuries usually caused by other fishes during fights or sometimes when the fishes jump out on being netted, then they undergo traumatic diseases. And coming to the degenerative diseases, these are caused by increasing the age of the fishes and the fishes develop heart failure, kidney failure, which lead to dropsy, skeletal deformities, swim bladder and balance troubles, some of the times neoplastic disease, cancers due to new growth and pigmented tumors, and other deformities under the degenerative diseases. Coming to the infectious diseases, all infectious diseases are introduced into a tank from another infected fish either directly or by transferring the infection via a net. And there are various pathogens, they cause the different kinds of diseases as now we have discussed. Some of them are viral diseases, some of them bacterial diseases, fungal diseases, protozoan diseases, helminthic diseases and the crustacean diseases. Let us discuss one by one. Come to the viral diseases. There are many viral diseases, but here only we have listed 5 like LYMPHOCYSTIS, viral hemorrhagic septicemia, infectious pancreatic necrosis, papillomatosis, infectious hemophilic necrosis. So As the introductory part, we will see the nature of the viruses. Viruses are the important disease-causing organisms in the aquatic habitat. The branch of science that deals with the causes, investigational techniques for identification of the viruses and their diseases is known as ichthyovirology. Ichthyovirology is the branch of science which deals with the fish viral diseases and the control measures. And here the virus is very smallest in size when compared to all the other pathogenic organisms. They are almost less than 0.3 microns. The size may be less than 0.3 microns, and they do not have their own enzymes or own metabolism. They multiply only in the living cells, and which may result in the degeneration and formation of inclusion bodies. Viruses are transmitted from one host to the other host through a structure called virion. And viruses cause diseases like by weakening the host tissue or by forming tumors on the host tissue. There is no treatment for viral diseases, but we have only prophylactic measures. They have to be taken up. Now see the diseases of the viruses which are causing different kinds of abnormalities in the fishes, like the lymphocystis, viral hemorrhagic septicemia, infectious pancreatic necrosis, papillomatosis, and infectious hemophilic necrosis. Let us see one by one. So this is the fish which is susceptible for lymphocystis. Generally, marine fish, freshwater fish, and aquarium fishes are susceptible to this disease. For the first time, Woodcock was the scientist who identified in 1904 the disease. What are the symptoms are? Tumor formation is the important character of this viral disease. Tumor formation. The external lesions are raised and made up of the growing of granular nodular tissue which is composed of many greatly enlarged host cells. Matured lesions may become slightly hemorrhagic. Hemorrhagic means secretion of blood. Within 6 to 15 days of infection, the growth of tumor takes place 50,000 times more. 50,000 times more. The only control measure is the prevention of the disease. That's it. It is a lymphocystis. Coming to the viral hemorrhagic septicemia. This is caused by the unequal shaped fish virus with RNA. The disease recurred in the trout aquafarms. Transmission of the disease occurs through the water by the flagellates. During easily infection stage, the fish appear lethargic and aggregate at the edge of the tank. Body shows dark coloration, bilateral exophthalmos. Exophthalmos means protruding of the eyes in the bilateral region. Paleness of the gills, swelling of the belly, and spongy dorsal muscles are noticed. The outbreak of the viral disease is known to be high in low temperatures during colder months, that is in the winter season. The symptoms are kidney swelling, reduced appetite, obvious distress, erratic spiral swimming, multiple hemorrhages in the skeletal muscles, change in body color, and the reddish fins. The fins are very reddish. Come to the control measures of the viral hemorrhagic septicemia. It will be prevented by supplying of vitamin A, B, and E. And we will also supply the rational feeding of 5% of feed for kg body weight of the fish. And you have to maintain the hygienic condition of the culturing pond. Coming to the third one, Infectious pancreatic necrosis, IPN. Infectious pancreatic necrosis. It is commonly found in trouts, usually Atlantic salmon and rainbow trout. They are easily susceptible for the disease. This disease causes high mortality. Mortality means death rate. It causes high mortality of the fry stage, fingerling stage, occasionally in the larger fishes too. The symptoms are darkening, distension, hemorrhages in the ventral areas including the bases of fins. There is pronounced pancreatic necrosis. Spleen and liver become colorless. Spleen and liver become colorless. What are the control measures? Are the only one control method to destroy the infected fish and maintain the hygienic condition in the breeding areas, otherwise the culturing ponds, and 200 parts per million of chlorine. 200 ppm chlorine is effective for treatment of the infectious pancreatic necrosis. Coming to the papillomatosis. So papillomatosis, it is exhibited in the form of a tumor. Here we will observe exhibit in the form of the tumor with a cauliflower-like appearance. Hence, this is also known as the cauliflower disease. This is also known as the cauliflower disease. This is caused by halophytic virus, and this is expressed in the form of foldings of the epidermal layer cells near the mouth region. These foldings grow into a papilloma. It is considered as a fibroepithelial tumor. It is considered as a fibroepithelial tumor. It is also known as a cauliflower disease. The control measures, the therapeutic treatment for, no therapeutic treatment for the papillomatosis is possible. The infected fish need to be destroyed to prevent the transmitting the infection to the other healthy fishes in the cultural pond. And coming to the infectious hemophilic necrosis, IHN. This disease was observed for the first time in the trouts in the British Columbia, that is Canada, in 1967. 1967 in Canada. It is observed in the hemophilic tissue of kidney in infected fish. This occurs more in fry stage, fingerling stage, and occasionally in the adults. The symptoms are pale gills, reddish fins, black coloration of the body, abdomen swelling, and huge mortality. The symptoms are clear in 12 to 45 days after the entry of virus into the host body. There are some other viral diseases in fish. They include Chinook disease, and channel catfish virus disease, and rhabdovirus infection of the grass carp. There are other diseases which are related to the viral disease. Come to the bacterial disease in fish. Bacteria are responsible for many fatal diseases in fish like columnaris disease, FURUNCULOSIS disease, vibriosis disease, dropsy disease, fin and tail rot disease, tuberculosis disease, bacterial gill disease, and the red spot disease. Let us see one by one. Columnaris disease. This bacterial disease is also referred to as the cotton wool disease. Cotton wool disease. Cotton wool disease. Now, it is very common disease observed in the culture ponds. The disease causing bacterium is Chondococcus columnaris. Chondococcus columnaris is the bacteria which causes the columnaris disease. This bacteria enters the body through injured areas, generally near the mouth. and the fungus-like growth develops. The diseased fish show the presence of grey fish-white spots on the head and the fins. The lesions become ulcerated. The dermal capillaries become enlarged, swollen, and get ruptured, filling the interstitial areas with blood. These are the symptoms of the columnaris disease, and the control measures are 250 mg capsule of chloramphenicol will be added per gallon water. Otherwise, oxytetracycline at 75 mg per kg fish body weight per day, they are very effective in controlling the disease. What are they? Chloramphenicol and the oxytetracycline. Coming to the furunculosis disease, it is caused by Aeromona salmoicida, which is usually cause furunculosis for the salmon fish. Actually, this Aeromona is a non-motile gram-negative bacterium. It requires an optimal temperature between 20 degrees to 30 degrees. Okay, and it usually infects the fish which are living in the dirty waters containing large amount of decaying matter. The first symptoms of the disease are appearance of boil-like lesions. The symptoms include ulcers and boils found isolated or in groups on the dorsal region of the fish. The ulcers are fringed with blood. The infected fish show lethargic movements and the body is seen with ulcers and boils. Bursting of the boils allow the spread of the disease among other fishes and also often suitable areas for fungus growth. Fishes severely infected with the bacteria die in good number. The mortality rate is very high. And coming to the control measures, either we may use the sulfonamides, otherwise the antibiotics. Sulfonamides like the sulfadiazine or sulfaguanidine are given orally with the food at the rate of 22 grams for 100 kg of fish per day. Otherwise, the antibiotics like the chloromycetin and tetracycline are very most effective at the dosage of 5 to 7.5 grams of drug per 100 kg of fish per day. Otherwise, we may also use the disinfectant like 0.015% of methionate or 0.185% of acreflavin will be used as the effective disinfectants. And coming to the vibriosis disease, the causative agent is Vibrio anguillarum. Vibrio anguillarum is the bacteria which causes the vibriosis. These are very small gram-negative bacillus bacteria, characteristically curved. In freshwater culture systems, generally pikes and the carps are known to be infected by the disease. The symptoms are large, bright-colored bloody lesions in the skin and muscles, hemorrhage in eyes, gills. Hemorrhage in eyes, gills may bleed with slight pressure and inflammation of the intestinal tract. So, these are the symptoms of the vibriosis. And come to the control measures, we will use sulfamethoxine at a rate of 2 grams for 100 pounds of fish per day. Otherwise, tetramycin at the rate of 3 to 4 grams of 100 pound of fish per day for 10 days. That gives satisfactory results. That is, we will use sulfamethoxine or tetramycin for the satisfactory results. Coming to the dropsy disease, this is caused by the bacterium Pseudomonas punctata. Pseudomonas punctata. So the characters are accumulation of yellow colored fluid inside the body cavity, protruding scales and pronounced exophthalmic conditions. This is known as the intestinal dropsy. In case of ulcerative dropsy, ulcers appear on the skin, deformation of backbone takes place and show abnormal jumping. This is fatal disease in culture systems. So what are the measures to be taken? Removal and destruction of fishes followed by draining, drying and disinfecting the pond with lime. These are the preventive measures to control the disease. The infected fish may be cured with 5 ppm of potassium permanganate. 5 ppm of potassium permanganate. For 2 minutes deep bath, streptomycin and oxytetracycline also give good results to cure the dropsy disease. And coming to the fin and tail rot disease, this is caused by Aeromonas salmonicid or Aeromonas liquefaciens. This disease is generally observed in the small juvenile fish, characterized by appearance of white lines along the margins of fish. The opacity usually progresses towards the base, eroding them and causing hemorrhage. The fin rays become brittle first and later on break, leading to the complete destruction of the fins. Here we are unable to see any fin all along the way except this dorsal fin. Fin and tail rot are associated with poor sanitary conditions, fish ponds, and with water pollution in nature. The control measures are to be taken. So, in the early stage, the fishes are kept in 0.5% of copper sulfate. 0.5% of copper sulfate for 2 minutes. Otherwise, we may also use 10 to 50 ppm of tetramycin or 1 to 2 ppm of benzalkonium chloride. In severe infections, the affected parts are surgically removed and the fishes are then kept in 0.04% of potassium dichromate. Thereby, we will cure the fin and tail rot disease. Then coming to the tuberculosis disease. This is caused by mycobacterium and it is very difficult to diagnose without any pathological examination. The symptoms are ulcers on body, nodules in internal organs, fin and tail rot, loss of appetite and loss of weight of fish. And control measures, the 1:2000 of copper sulfate for 1 minute for 3 to 4 days. The diseased fishes should be destroyed and potassium permanganate or lime is used in the pond. And coming to the bacterial gill disease, this is caused by the myxobacterium. Many bacteria are found in swollen gill lamella which show proliferation of the epithelium, and symptoms are lack of appetite, presence of excessive mucus on the gill filaments. Fish become pale in color and lethargic. The disease causes hyperplasia of gill epithelium. And what are the control measures? It is transmitted through water from infected fish. It can be treated with 1 to 2 ppm timson or 1 ppm of copper sulfate. Prophylactic measures to be taken. Coming to the red spot disease, this is caused by Aeromonas liquefaciens. It is noticed on the freshwater fishes, carp, salmon and perch. The disease is exhibited by the presence of round or oval shaped whitish round bodies. In certain areas, loss of scales followed by the necrosis of the skin occurs. The infection is known to cause hemorrhages in liver and also in the kidney. Hygiene, the control measures are hygiene of the equipment used in the farm, pond, and that should be maintained. And the other bacterial diseases also there which cause the various diseases to fishes. Coming to the fungal diseases, there are only three we have shortlisted: Saprolegniasis, Branchiomycosis, and ICHTHYOPHTHIRIASIS. These are the three major fungal diseases which attack on the fishes. See the Saprolegniosis or Legniasis. This disease is also known as the cotton wool disease or water mold. Cotton wool or water mold disease. Cotton wool or water mold disease caused by Saprolegnia parasitica. It is the most common fungus affecting the fishes, especially major carps. This disease is present in all aquarium waters but only attacks the fishes where damage to skin has occurred. The parasite grows at the skin wound, producing a cotton wool like growth, but mycelia eventually enters into invade the body tissues. The infected fish becomes weak and lethargic, or exfoliation of the skin followed by hemorrhage, exposure of jaw bones, blindness, and inflammation of liver and intestine takes place in the Saprolegniasis disease. And the control measures: the contaminated fishes should be removed and wound treated daily with 5% of methylene blue. 5% of methylene blue is used. Otherwise, 1 to 3 ppm of malachite green for 1 hour. Otherwise, you can keep the fish in 1:500% of formalin for 15 minutes. Otherwise, the infected fish can be treated with potassium permanganate at 1 gram of potassium permanganate for 100 liters of water for 90 minutes, 1.5 hour. So, this is a Saprolegniosis. Coming to the Branchiomycosis, which causes the Gill rot disease. This is caused by Branchiomyces demigrans. Branchiomyces demigrans or Branchiomyces sanguinus. It is a common disease on cultivated fishes in the ponds where there is an abundant amount of decaying organic matter. The tubules of fungus grow into the respiratory epithelium of the gills, causing inflammation and damage to their blood vessels. Thereby, the blood supply is stopped to the infected area, as a result of which it becomes necrotic. The prophylactic measure is to maintain pond hygiene by avoiding high levels of organic matters in the feeds. And the control measures is 5% of common salt. 5% of common salt is used for 5 to 10 minutes. Coming to the next disease, ICHTHYOPHTHIRIASIS, which is caused by Ichthyophthirias hofferi. This is commonly known as a reeling disease. Reeling disease. It is another widely distributed fungus and probably cause many of unidentified deaths in the fishes. The fungus grows through the intestinal lining and disseminates throughout the body. So the disease causing agent is the Ichthyophthiriasis hofferi. The control measures are taken up by using medicines like sulfamethoxam, terramycin, erythromycin, and calomel. They are very useful to treat the infected fish. So these are about the fungal disease: Saprolegniasis, Branchiomycosis, and Ichthyophthiriasis. And coming to the protozoan diseases. Among the protozoans living in the aquatic medium, some groups are parasitic to fish and cause various diseases. Especially, sporozoans are exclusively lead a parasitic life. In the aquatic system, they cause disease to the fish. There are various diseases caused by the parasites like whirling disease, nodular disease, ichthyopthiriasis disease, trichotillomaniasis, and chylodinella disease. These are the protozoan diseases to fishes. Let us see one by one. This is the whirling disease in the salmonid fish. This disease is caused by Myxosporidian protozoan, which is called as the myxosoma. Myxozoma is a protozoan parasite. Myxozoma cerebralis. Myxozoma cerebralis is the protozoan parasite which belongs to the Myxosporidian group of family. It is common in the culture ponds affecting the young trout, fingerlings during the farming. The symptoms are pancreatic necrosis, lesions, and disintegration of the cartilaginous skeletal support of the organ of equilibrium. Organ of equilibrium means semicircular canals. A rapid tail chasing type of whirling is often when the fish is frightened or trying to feed. Control measures are pond hygienic conditions to be maintained. Contaminated ponds should be cleaned thoroughly and disinfected with calcium cyanamide or sodium hypochlorite. Sodium hypochlorite. Coming to the nodular disease. This disease in the culture ponds is caused by the Myxobolus species. In carps and pike it is common. The parasite infects the skin, gills and the internal organs. The disease is exhibited in the form of round and oval white pinhead sized cysts on the body. The infected fish in the pond are to be destroyed for preventing the contamination of adjacent ponds. And other diseases like ICHTHYOPHTHIRIASIS. This is commonly called as ICH, or white spot disease. It is also known as white spot disease, which are usually seen on the fish body. It is caused by a ciliate Ichthyopthirius species. Ichthyopthirius. The young parasites moving in water get attached to the skin of the fish. They grow between the epidermis and dermis and after becoming large in size fall to the bottom of the pond. Infected fish develop small white spots. See here and there. Small white spots on the skin and the fins. The spots may join together to form white patches in advanced stage of infection. These parasites attack the gills also. Fish respond by jumping in the water and rubbing their body against the objects in the pond. Respiration gets affected and they finally die. So, what are the control measures? Dip treatment in 1.5 ppm of malachite green or 10 ppm of acriflavin, that gives a good results. So, you may use 3% of salt solution or 1:4000 formalin, 1:1 lakh quinine hydrochloride, 1:5 lakh methyl blue. They are also useful to treat the fish which are suffering from Ichthyopthiriasis disease. Then come to trichotillomaniasis. It is caused by a ciliate Trichodina domergue. It infects the skin and gills of the fish. They can't be treated. They can be treated with tripaflavin. Tripaflavin can control the disease. Then coming to the Chylodinella or Chylodinella disease. The ciliate parasite Chylodinella cyprinid. Chylodinella cyprinid causes the disease in the culture fish ponds. The parasite infects the skin and produces bluish white opaque color of the skin in the ponds. They are known to destroy the gill epithelium. The control measures are application of malachite green at 0.15 milligram per liter concentration. The disease can also be controlled by reducing the stocking density in the pond and maintaining optimum water quality parameters. Then coming to the helminthic diseases of the fishes. The common disease caused by the helminthic parasites are the dactylogyrosis and gyrodactylosis. Let us see one by one. Dactylogyrosis disease. The monogenic trematode, which is known as the dactylogyrus, it causes the dactylogyrus serious infection in fishes. Some other species are also there. Dactylogyrus extensis, Dactylogyrus vastator, Dactylogyrus lamellatus are found in carps. The parasites are found on the body, fins and gills. Infected fishes rest near the surface of the pond margin, swim very slowly, feel suffocation, more slimy, dropping and folding of the fins, and they have pale gills. The control measures are: the parasite can be controlled by giving a bath in solution of formalin for a period of 30 minutes or by giving a bath in salt solution, Bromex 50, that is 0.18 ppm, and Dilox 0.25 ppm are effective to control the dactylogyrosis disease. Coming to the gyrodactylosis, monotreme trematode, that is a Gyrodactylus causes this disease. The parasite lives on fins and on the body of the fish. The symptoms are: the body is more slime, damage of fins, fading of the body color. The infection can be controlled by giving the fish a bath in formalin for a short duration. And the other helminthic parasites also, they cause various diseases like Botryocephalus, Clinostomum, Diphyllobothrium, Diplostomum, and spring-headed worms. Acanthocephala causes disease in fishes. Nematodes also cause disease in fishes, of which some of the common nematodes are Philometra and Camellanus. Coming to the crustacean diseases. In the culture pond, some groups of crustaceans are known to infect the fish and cause disease. There are 3 crustacean diseases: ARGULOSIS Disease, Ergasilus Disease, and Lernaeasis Disease. See one by one. ARGULOSIS Disease. This is the ARGULOSIS, which is fish lice. It is caused by an ectoparasite Argulus, commonly called as a fish lice, on fish in the culture ponds. The parasite can move over the body surface of the fish. Argulus puncture the skin and inject cytolytic toxin through the oral string to feed on the blood. The feeding site becomes a wound and hemorrhagic. It transmits dropsy in fishes. In advanced stages, fish swim erratically, show growth loss and loss of equilibrium. Here you can observe these all are the parasites. This is commonly called as a fish lice. Argulosis disease. Argulus is the organism, disease causing agent. This disease can be controlled by giving dip treatment to the infected fish on Lysol or Prizol or in potassium permanganate or in any insecticide for a short duration of time. This is the argulosis. Coming to the Ergasilus disease, the causing agent is the Ergasilus species. This is the Ergasilus. Here the parasites are found attached to the gill filaments and feed on the blood and the epithelium of the gill lamella. Later they may also be found on the fins and body. The infection results in impaired respiration, epithelial hypertrophy, anemia, retarded growth, restlessness, and finally death occurs. Control measures are to be taken. Ergasilus can be treated successfully with a combination of 0.5 ppm of copper sulfate and 0.2 ppm of ferric sulfate for 6 to 9 days. Management of the pond hygiene is one of the most important steps to control the spread of the disease to other ponds. Then come to the Lernaeasis disease. The disease caused by the Lernaeasis. Lernaeasis. The infection is noticed on the fins and near the eye of the fish. Early infected fish swim erratically, flashing against the sides and bottom of the ponds. Heavily infected fish swim upside down or hang vertically in the water. The parasite can be controlled by applying 500 ml of dichlorovas per acre of water spread area. Hence, prevention is more effective than control. 1% of common salt eliminates the larvae in 3 days. 250 ppm formalin for 30 to 60 minutes. In general, disease occurrence in the culture ponds could be controlled by adopting best management practices and avoiding the use of antibiotics and drugs. It is difficulty to identify the appearance of diseases in its initial stage on account of the gregarious nature of fish in water, which causes difficulties in observation, diagnosis, and timely treatment. Apart from this, some effective drugs and measures to be taken to cure the certain fish diseases and are still not known well. Therefore, perfect preventive measures must be taken since this is a key link in fish disease control. So, under this topic, we have studied different kinds of diseases and their control measures. Thank you one and all.